Now.
Hello everybody, my name is Ugochi Abukichi and I am a senior at Emory University, and I'm going to be doing a presentation on something called obstetric fistula and why you should be concerned about it. Okay, so what we're going to talk about today is what is exactly fistula, who does fistula affect, what does fistula do to the quality of life, and how fistula is a challenge to human rights, and why should you care or help. Okay, so obstetric fistula, it is a hole or tear in the tissue wall between the vagina and the bladder or rectum, or it can be between all three. So what happens basically is during a prolonged labor, and so that's when a woman is giving birth. Usually she has contractions in her body that help push the baby along in the birth canal, but when you have obstructed labor, there's a blockage, or your pelvis isn't wide enough for, a woman's pelvis isn't wide enough for the baby to come through, so then it gets stuck, and the head will usually crush against that tissue that's between the bladder, and it can, the tissue can become necrotic, which is basically dead, and so it can slough off, and then that's when the hole or the tear will form in the woman. And so obstructed labor in some places sometimes can last up to 3 days. So these women will be in labor literally for 3 days. And so by the time that the child comes out, it's usually stillborn. Sometimes they have to take it out in parts. And once the child is gone, the mother is left with the obstetric fistula, which is usually she'll have an incontinence of urine or feces, so that's like a miscommunication in the body. And so instead of her body giving her that pressure and telling her that, oh, it's time to go to the bathroom, she will just go. And a lot of women leak. They can leak urine or feces or both. And so it's a really big problem. So sometimes you can get fistula from pelvic surgery. That's 70% of them that happen in the U.S. and the United Kingdom. But in resource-poor areas is where 90% of obstetric fistulas occur. And so there's really not a cure for obstetric fistula besides surgery, and you need to have that done by a skilled surgical technician. But there's also ways to prevent fistula, which is improving maternal care, community awareness, and vocational / educational opportunities for girls. Okay, so a typical fistula patient, and we're focusing on these resource poor areas that I'm talking about, so that's places like sub-Saharan Africa or South Asia. So the female usually is giving birth for the first time. So this is her first child, and what happens is that she's usually short in stature and small and malnourished, because in a lot of these places they're patriarchal societies, so it's custom for men to eat first. So the women will cook and men will be served, and they eat as much as they want, and then it's not men go first and then girls follow. It's they eat what they want, and then whatever's left the girls will get. And so a lot of the times what happens is the girl will become malnourished, and so then her body and her pelvis does not mature, and then her age at first period, the average age at first period is usually 14 and a half years old. So that's the first time that you're able to give birth, is when you have your period. And then these girls are also getting married very young. So the average age of marriage is 15 and a half years old. So it's only a year out from her first period. And she's usually probably really tiny because she's malnourished. And she's been malnourished in her developing stages. And so then when she does become pregnant, that's what creates the smaller stature and smaller pelvis, which can obstruct the labor. Okay, so once someone does develop fistula, there are some challenges that they encounter. So some social challenges for women is that the fistula is considered a social calamity, and a lot of times in their communities they will get left by their husbands because these women are leaking constantly, and they smell really bad, and no one really understands what it is. So some people feel it's result of an STD, so that's her being unfaithful to her husband and thinking that she's brought back some kind of disease, sexually transmitted disease, or a lot of people think that it's punishment from God, or divine punishment for certain other religions. So And women also feel rejected and don't receive support from their families and the community at large, because a lot of the times they'll be not allowed in their houses, and so they'll have to like sleep outside or sleep out in the back or some like makeshift hut that gets created for them because of their smell and because they think that they're like an abomination essentially. And so with economic challenges, these women often aren't employed like before they have their child and before the obstetric fistula has developed, but then like once it has, they're like very much unable to get work, and if they've been thrown out by their husbands or left, they have to rely on relatives if those people are in the picture. And then with the relatives, a lot of women have to end up begging for food and begging for money and just begging for everything that they can get. So it's like a really big problem on their social and economic lives. And then also emotionally, a lot of women face some challenges. So depression is something that occurs among fistula patients. There was a study done by Weston et al. There was a study done by Weston et al. And they did a cross-sectional study. So that's like a study that you do at a particular defined time, and it's really good for finding out things about acute and chronic illnesses in certain areas. And so they interviewed 70 women in a surgical camp in Kenya, and who were fistula patients, and they basically asked them like a series of, it was like a questionnaire interview-based thing, and they found that a lot of 72.9% of the women were depressed, and 25.7% out of those women were actually severely depressed as a result of their fistula, and it's mainly because of the reasons that we stated before, with the social and economic challenges, and also not feeling very supported. Okay, and so also there's some implications for family dynamics, because a woman's health has a lot to do with the health of a child, of a newborn, or just the family in general. So women who do not survive labor, like their child is more likely to die within the first month of their life when a woman when the woman is no longer alive. And then also a lot of, like as I said, these births result in stillbirth. So then the woman has her emotional issues, and then the fact that she also has fistula on top of it and doesn't receive support in most cases from her husband, and that also creates a divide and like a strain on the marriage, and also with her community and her family, because a lot of these places in resource poor areas, families are usually pretty tight knit. So then once she's rejected by one, she like essentially doesn't have anywhere or anyone to turn to. And so going on to health as a human right, at a convention that was focused on the economic, social, and cultural rights, declared that the right of everyone to the enjoyment of the highest attainable standard of, everyone has a right to the enjoyment of the highest attainable standard of physical and mental health. And with fistula, obstetric fistula that occurs in these resource poor areas, they are not receiving the most highest attainable standard of health. And it really mostly has to do with the areas that they are giving birth in, and it's nothing on them as a person, because a lot of these women who are in the resource poor areas, they don't have skilled attendants, which is someone who like is aware of obstetric care and emergency care in times of giving birth. And so that's why these obstetric fistula tend to develop in these areas, because these women don't know anything about giving birth, so they're not aware that once you're in labor and you've been in labor for like a day or two, like that's really serious, and that even if it's more than like, you know, if you're having contractions and you don't see the baby coming out in a certain amount of time, you should go and get help. But these women are unaware of that, and so that the birth prolongs and the labor becomes obstructed, and then the fistula develops. And that's the thing, is that fistula is very preventable. It is highly preventable if you just have education and they have a proper obstetric care for when things, when the birth is obstructed, that fistula could be avoided altogether. Like it's not really like a natural thing that happens in childbirth, like hemorrhage or other things like that, with too much blood and things. It is something that's very preventable and does not need to occur, and so these women have rights. They should be able to bring children into the world and not suffer such a detrimental injury. And so, what can you do to help? So there's a couple of places that you can go on. You can honestly go online and Google how to help fistula, but one place that I wanted to highlight is the Fistula Foundation. Their website is on here. and I'll probably link it in this description box as well. They help women in 28 different countries, and they help with giving surgery and just care and support for these women who have undergone fistula, and then also they help with like preventative programs that can hopefully end fistula in these resource core areas. So, okay. So that was my presentation. I hope that you have learned something here today and that you will go on and learn a little bit more about fistula. If you have any questions or comments, you can put them in the comments bar below, and I'll try and get back with what I know. But so yes, thank you so much for listening, and I hope everyone has a good day.